terms of the role of a nurse in an acute care environment, nursing really keeps the flow of the hospital going. So from the emergency department into the inpatient units, nurses are involved in that frontline triage, making sure that we're getting the patient to the right place. Certainly they're collaborating with physicians and other healthcare providers in that process, but they're really at the center of throughput or patient movement throughout the system. And then on the inpatient side, making sure that the care that's being delivered is going to set the patient up in the best way to get to their next level of care, whether that be that they're going to be discharged home, whether they're going to go home with home health, they're going to go to a skilled nursing facility, a rehab facility. Nurses are at the core again, whether they're the bedside nurse or an RN case manager who's working on that discharge planning piece. Nurses are at the center of that movement through the system and ensuring a safe discharge for that patient so that they don't run the risk of a complication when they're discharged or readmission to the hospital, something like that. We see an average daily census. We're running right now around 500 patients, average daily census, so meaning there's 500 inpatients here every single day. We run around 300 emergency room visits every single day, and so we see a huge volume of patients, not only from our local community, but also a large population from our rural communities. So we are a tertiary care center. We get a huge influx of patients from outside of the community as well. So that poses challenges for nursing. It's really important for us to keep the patient safely moving through the system. We know that the purpose of the emergency department is not to have patients stay down in the emergency department for hours and hours on end, and so it's important that we have processes in place to ensure that those patients are appropriately triaged. If we need to admit them to an inpatient unit, we get them to that unit and to that level of care as quickly and as safely as we can, and then continue to move through the system.